I actually got involved with Planned Parenthood randomly, but I stayed by choice. I'm a staff member down at the Naples Health Center, and the reason I got involved there was because I knew somebody there, then I got a job. I worked as customer service, and then I got really touched by the people that we were helping, and their stories really affected me. I saw the good that we were doing, and that's how I became more involved, and that's when I had the opportunity to get a promotion, I went for it. And now I'm the volunteer and advocacy coordinator down there, where I do outreach work in the community. We garner volunteer interest, and we do a lot of good. And I'm really glad that we're here, and I'm really glad that Sarasota has been here for 50 years. It's been 50 years of birth control, 50 years of assistance in the community, and 50 years of family.
Hay que aprovechar, ¿oíste?
Not just for women, that's the big thing. A lot of people think it's just for women, and it's not. I have a friend who's a victim of sexual assault and was forced to have a child because they didn't have access to the medical facility because they lived in Texas.
It seems every cycle there's always some type of bill that is in contention to try to do something to either defund or restrict the activities of Planned Parenthood, and it's really unfortunate because what they're really doing is denying access to quality health care for women who can least afford it.
We serve all genders. Many of our patients do identify as female. Majority of our patients are seeking services that are related to birth control, STI testing, and cancer screenings.
Well, as far as the local affiliate's concerned, I'm not under the impression that a lot of taxpayer money is being used to fund any of its activities. I could be wrong. I'm not on the board anymore, so I'm not familiar with the intimate details of the financial picture. But I know that there's financial support from the government for a lot of other different activities, giving women access to quality reproductive health care ought to be on the roster of things that the government could support, especially since it turns out to be supported eventually either through emergency room visits or some other backdoor social service. My understanding from years ago, there was a quote that said that $1 of prevention actually saves $23 in social services that have to be delivered down the road. It would seem to me that would be a good investment on the government's part.